Hi, everyone. I'm Dr. Funke Afolabi-Brown. This is going to be such a fun conversation. I mean, this is what I say every time I have a candid conversation. And I was just telling Dr. Cohen, like literally before we jumped on that, this talk is selfishly for me as well. And but I'm really hoping that you all benefit because here's the thing, right? I mean, this is what I do for a living. I help people sleep better, right? And breathe better. And one of the tools we use is CPAP. If you have sleep apnea, that's one of the tools that we have in our toolkit, which has been shown to be helpful. But we do have quite a number of people who just struggle with CPAP, either because they can't tolerate it or something, or they just don't want it. And we also have this other dimension of sleep where it's beyond sleep apnea. We're really looking at sleep health globally, right? And this friend of mine, who also happens to be like literally my neighbor, like our practices are like just a few minutes apart, really brings an incredible perspective. So I'm just so excited to have Dr. Cohen here, who is a phenomenal dentist that's looking at sleep in a whole different way. And so we're going to be talking about, sleep apnea beyond CPAP. So super excited to have you with us today, Dr. Cohen.
I am so excited to be here and so excited to share my story with your audience because, not only am I someone who treats it, but this is me. This is my story. I've been struggling with sleep apnea since, well, in hindsight, since I was in my 20s, but I didn't figure it out until 2012. And then it got so bad that I've been looking for answers since 2012. And I can sit here and I can say that after 13 years of struggling, I've resolved myself of sleep apnea and I'm a healthier person today. And, my message and what I try to tell my patients is I'm fighting for quality of life. And, I want to give people options because not everyone is ready. Like you said, they just don't want to use CPAP or, they have a problem with it. From a dental aspect, we know that there are oral appliances. Not everybody wants to do that. We have to have multiple options to help our patients, both from an anatomic standpoint, there's a problem with the bone, and also from a total wellness standpoint. And that's what I love to do.
Literally chills. And I cannot wait to get into your story because I think it just brings so much hope for people out there who are saying, is this a life sentence? And you are a testament to the fact that, well, it's not. You can actually reverse sleep apnea using, multiple modalities, but also using the power of resilience and figuring it out. And you figured it out. And I love what you've done with that, which is that you've turned it around to help other people. Like what else is there beyond that? I just think it's so incredible. So let's jump in. How is it that a dentist is here on this stage talking to me about sleep apnea? Please help me understand that piece first, and then we could start to get into more of your own story and how you've really built a practice that's helping so many people.
So, you know what? Some of the backstory is so important to how I got to where I am today. My entire life, I struggled with this feeling of fatigue. No matter what I did, I used to plan my entire day around like, when could I sneak in that 30-minute nap? Or, maybe I could just, in between patients, close my eyes for 5 minutes. And if I did, I knew I would feel better. And I never did. And it turns out that my best friend, who was also a dentist, went to dental school. He was diagnosed with cancer, multiple myeloma. And this is about 2007. And we used to go out to our advanced dental education center and we would share a room together. We wanted to enjoy whatever time we had. And he was really going through a tough time with his treatment. And I was afraid that my snoring was going to keep him up. So I made myself a dental appliance. I woke up the next day and I was like, wow, like someone took the fog away. Like I felt so good. And it turns out that my first patient of the day was a sleep specialist down at Temple, and he said, Andy, I think you have sleep apnea. Let's test you, which I did. And I had mild sleep apnea. And the appliance worked great for like a little bit. And then I started to get snoring again, and I started to feel more tired again. And then, I actually fell asleep in the show Cirque du Soleil in Vegas, which is like impossible. I mean, it's like visual stimulation. That's how tired I was all the time.
Wow.
And so I made an appliance. I got a little bit sicker. Then I got diagnosed with high blood pressure, and they started me on medication. And then eventually I had another medication. And then I learned about laser treatments and nasal breathing, and I did everything. And then I just kept getting worse. So I'm like, all right, let me fix it. Let's fix the anatomy. That's what everyone told me was the problem. And that's what dentists are really good at evaluating. We can evaluate the bones of the face, where that basically wherever the bones are, the soft tissue drapes over it. And if the bones are in the wrong spot, that soft tissue gets close together, snoring, or closes off completely, sleep apnea. So I said, well, you know what? My anatomy's all messed up. I had a deviated septum. My jaws were set back. What could I do? And I did skeletal expansion. Well, the crazy thing was I got worse. And the reason why I got worse is because my metabolic health was not well. So each step along the way, I got a little bit better. But if the foundation to your health isn't good, then ultimately it's just a matter of time before you get sick again. And my perspective, how I look at sleep apnea now, it's an inflammatory disease. You have an inflammatory process going on. It's going to affect your soft tissue. Things aren't going to work. And that's going to ultimately lead to disease. And sleep is so important because, as you know, the body repairs and recovers when we sleep. That's our time to get healthy. And if we're not getting the proper sleep, that's a problem. So a year ago, when I went from mild sleep apnea to a year and 3 months, I had severe sleep apnea, and I spent an hour below 90% oxygen level. And I knew then I needed to do something. All of my mentors told me I needed double jaw surgery, bring everything out, open up the airway, but didn't seem right to me. So I went down this metabolic rabbit hole for the most part. And in a year, I lost 40 pounds. I'm off all my blood pressure medication. I have no more reflux. I have no more sleep apnea, and I don't have to wear anything at nighttime. And that, when you talk about resiliency, it takes dedication and a choice. My choice literally was eat pizza or be healthy and be around for my kids when I get older. Now, I still eat pizza, but I learned how to do it. I learned what I needed to do to restore my body's energy function and how I needed to block blue light to make my metabolics work better. So what dentists have to offer is, and well, ENTs as well, we have the ability to improve the anatomics. And that can be anywhere from breathe right strips to surgical intervention and everything in between. And then we have this other box that I am passionate about helping my patients, to give them the option of being an advocate with them and helping them improve their metabolic health. You know, someone asked me the other day, they said, how would you describe metabolics to someone? And I would describe it as all disease is based in not having enough energy to make your body system work. And the whole concept of circadian health and resetting your metabolic health is to make sure your body is supplied with enough energy so it can do the job that it needs to do. And that's really what I'm there to help my patients with. I do that through resetting and anchoring their circadian rhythm. I help them moderate their sugars. I talk about some of the dangers of blue light and how you can minimize it. I talk about red light, which is like on fire in the medical community right now, and all the inflammation effects that can have. It's taking a well-rounded approach. It's giving options to patients. And all I ask is one thing: what can you say yes to today? Because I can promise you, if you start to feel better today, tomorrow, you're going to be able to say yes to more things. And I give options. And that's what I love. I get so excited to go to work and help people with all of their chronic diseases, not just sleep. And it's, I always say, okay, we got to get past the elephant in the room. Why is a dentist talking about this stuff? Because this was my life. And I love working with physicians like you and functional medicine docs and primary docs and, ENTs, because I have something that I can add for when their patient says no to CPAP or says no to Inspire or says no to doing surgery. Well, there's other things that we can do. And that's informed consent. That's letting people know that they have options. Wow, I just rambled on like nonstop. Jump in.
No. Oh my goodness. So much to unpack right there, right? Like what you said, right? So I think let's even start off with this. First of all, powerful story. I mean, you literally turned what felt like a life sentence into a cure, right? So I just think that is so powerful, and I think so many people need to hear this, right? That there's hope. And so maybe we could even start to say, there was something you talked about, which is fixing the anatomy, right? So what is that interplay? What role does anatomy have? And what role was this whole metabolic health? What role does that have for that person who's coming in exhausted and tired of being exhausted and, has tried CPAP and is just really at a loss of what to do? Walk us through what those other options are.
Yeah,
we know CPAP works. We get it, but it works as long as it is used.
Correct. So you know what? When you try to fix the anatomic problem, and so I actually take a top-down approach. So the first thing I look at is the nose. Is there a deviated septum? Why is that important? If you can't breathe through your nose, then the body has a choice. Figure out another way to breathe, or it's see you later. So it opens your mouth. And when you go to sleep and you're lying down, where's your tongue go when you get on your back? It falls in the back of your throat. So if you're breathing through your mouth, the air has nowhere to go. When I look at people, I look at them from the left to right dimension. That's called the transverse. Well, I describe that to patients like a towel. So if I put my hands, let me get you in the camera. If I put my hands like this and I move them in with a towel, what happens to the towel? It droops. Well, that's the effect of the soft palate. If someone's anatomy is too narrow, their soft palate's going to droop. Their tongue is going to be squished. And when the tongue is squished, the back of it sits up very high and blocks your airway. It obstructs it. When the jaws are set back, if your top jaw is not out far enough, which is a component of tongue function when you're a child, if it's not out far enough, your soft palate's further down your throat. If your bottom jaw is set back, your tongue is pushed back in your throat. So the net effect of the bones being in the wrong place is the soft tissue gets squished. And that's what I look at. And then I say, okay, here are your anatomic options. If your soft palate is elongated, I can use a non-surgical laser and I can shrink that tissue, and that will open up your airway. I can make a dental appliance to bring your jaw forward. When you do that, that pulls the tongue forward, opening your airway. I can put nasal dilators in someone, and the dilators open up the nose to maybe get around the deviated septum. My goal is to prove that it will work before we talk about doing something invasive. And I'm much more aggressive at fixing anatomy in children because they have their whole lifetime ahead of them.
Yeah.
I have a myofunctional therapist in the office who has her own practice. Getting the tongue to make a proper seal along the roof of your mouth is the only way you can ensure nasal breathing. So we have to sometimes release that tongue because the muscles are so strong that when you go into your more atonic state in sleep, your mouth pops open. And when your mouth pops open, you can't breathe well through your nose. You can't produce nitric oxide to dilate your nose. And that's ultimately what I'm looking at. By taking three-dimensional imaging, I can evaluate all of the bones, and then I take photos of that soft tissue to figure out what makes the most sense to the patient. And then I review it with them, and I show them, and I say, here is your problem. This is the cause. This is the effect. This is how we get around your problem. I like to compare myself to like a quarterback. I'm the one who makes sure that I get the ball to where it's got to go. And where it's got to go is, how am I going to get you to feel better? Because really, you know, as you were talking about this and what I was thinking about, in my own story, I wasn't present in my family's life because I was always so tired. So when I say that I'm fighting for quality of life, you know, I unfortunately just lost my father-in-law. He had 3 weeks ago, and he had a stroke 3 years ago. His quality of life was, I wouldn't wish it on anyone. So when people say to me, well, you know, I'm feeling pretty good now. Yeah, you're feeling pretty good until you have that one problem where you don't. So let's do everything that we can to be more preventive. And the reason why this is my soapbox and why this is what I want to do with the end of my career is because I don't think that healthcare is taking preventive medicine seriously enough. I think we spend too much time trying to give a medication or trying to give a surgical procedure, where if we took simple steps to make America healthy and, you know, through metabolic health, I think that the quality of life will be better for longer. And we all have an expiration date. What I want to do is make that quality of life as good as it can be for as long as it can be. And if you're not getting proper sleep, you know, just as well, it's not going to be good quality.
Yeah. Yeah. So true. We're not, that's one guarantee. We're not making it out of this world alive.
Yeah.
So what do you do with the time that you have here, and how do we make it a life that is full, that a life that you want to wake up to every morning, right? And I love that you're looking at this so holistically. And some of the things that struck me is you're looking at anatomy. So you talked about from the nose, you know, to that airway, that nasal pharynx, optimizing that nasal breathing, to the back of the throat, the soft palate, the jaw, you're looking at structure as well. How do you now combine it with that more like function / metabolic piece? Like, when does that conversation come up when you're evaluating patients?
Yeah. So I know that if a patient, I mean, I do a very detailed medical history. So if I'm seeing reflux, if I'm seeing heartburn, if I'm seeing AFib, if I'm seeing high blood pressure, and I know that they have a sleep disorder, their body is giving them signs there's inflammation. So ultimately, metabolics is, how can I restore the energy function to make body process work better so it can process things? So in my studies of the last year and a half, as I dove into learning everything that I could about circadian rhythm, quantum biology, the physics behind this, what I learned is that the body will do whatever it can to protect the brain and the heart. And what ultimately happens is our other functions start to go by the wayside. Why is that becoming more prevalent in the last 20 years? I will tell you, it's because society has moved more indoors, and the blue light negatively affects our metabolic health. It actually sabotages it. So what we can't produce in blue light is leptin. And leptin is the top of the food chain for me. If your leptin system isn't working, then your body, it's going to lead to insulin resistance. So I'm fighting for leptin. And the only way we can get leptin to work is through sunlight. We actually need to get infrared and near infrared light, which we get at sunrise. And I relate that to my patients as you have a Ferrari. The human body is a Ferrari, okay? And red light are the keys to that car. UVA light is the gas to that car. And UVA light stimulates leptin production. It does that by cleaving POMC, and blue light destroys POMC from being formed. So we need that. And then ultimately, the engine is UVB light. And without those three things, that car isn't going to run. You can run a perfect light day. Get your red light, get your UVA, get your UVB. If you have blue light at the end of the night, once the sun goes down, it destroys everything that you were doing. And how that happens is it tricks the body into thinking when it's nighttime, the body thinks it's daytime. Mm-hmm. So your body is in chaos. It doesn't know what to do. And the result of that is inflammation. And when there's inflammation, ultimately, that's what causes things to break down. And I use vitamin D as a marker. And what I'm looking for is patients to have a higher, especially if they have sleep apnea, I'm shooting for vitamin D of between 60 and 80. And, you know, if you look at the values on your blood work, it's like 30. Well, that's not high enough. And why is that important? Because the body, the energy system is the mitochondria. And ultimately what happens is you need melanin in order to make the mitochondria go. There are ways to incorporate sun exposure in a safe way where it's not going to, because the question I get immediately is, oh my God, you want me to go in the sun? Skin cancer. Well, I'm going to tell you that if you really dive deep into a lot of the studies, they're misleading. And I would actually suggest, look at the all mortality study that they did in Sweden, where they had 29,000 people and they found that there was a greater incidence of death in people who are sun avoidant. And it's an easier concept actually for patients to get than it is for many physicians to get, because we're so ingrained in the sun is danger, the sun is danger. Well, why is there no MS at the equator? Mm-hmm. Because it's an energy problem. Mm-hmm. So that's how I'm going about it. That's how I was able to fix myself. And I remember when I went to my physician and I told him what I was doing, he laughed. And mm-hmm. I said, look, I get it. 6 months ago, I laughed too. The people who were teaching me, it made no sense. And then I dove into physics, and it's all about light. And mm-hmm. as we learn more about all the different spectrums of light, you can see the benefit. And I'm excited to tell you and your audience, it was just announced in April of next year. I'm actually, through Airway Health Solutions, coming out with a mini residency all about ways that you can help be an advocate. Please understand, the treating is your job. I'm an advocate to help guide my patients restore their metabolic health in conjunction with their primary health team. And I think the combination of improving your metabolics and addressing the anatomy is really the way that we're able to tackle this and get people healthier. And here's the best part. The sun is free. It doesn't cost anything to go outside.
Exactly. Oh, I love it. So now it sounds like, you know, this is the thing that I tell my patients too, and my audience, which is let light be your friend. Like, embrace the light, like head towards the light, but it's the timing of the light, like you said, right? The same light that you're exposed to in the morning has a whole different mechanism in the evening. So walk us through, are there specific timing that you think is optimal, right? Both in the morning to optimize metabolic health, as well as the evening to improve, sleep health overall.
Absolutely. So
Mhm.
that's such a fantastic question. So I use sunrise as the anchor to, when you get light in the eye, it goes to the SCN and it tells the pineal gland, stop producing melatonin. It's time to wake up. So that the SCN is your master circadian clock, and it resets all the clocks in your body. So that 30 minutes at sunrise, transitioning into UVA light, which is about an hour after, is that really important to get the engine going. And then I tell my patients, go outside for lunch and just eat outside 20, 30 minutes. That's really all you need to get your UVB getting up, your vitamin D get up there. And then the best part is when you get some sunset light, any UV damage that you do, the red light fixes it, because red light is 100% anti-inflammatory. So you can build your solar callus by just doing 30 minutes 3 times a day in the different lights. And I use an app called My Circadia, which is free, and it tells me where all the lights are and when the optimal time is that I get outside. Once the sun goes down, I put on my blue light blocking glasses. And what I'm trying to do there is signal my body it's time to get ready for bed. And when you block blue light, you're going to build up melatonin. And when you build up melatonin, that's your sleep drug. That's what you need to do. And we need to make it naturally, because when you take it in pill form, the half-life is very short. So you see people where they get to sleep and then 2:17 every night they wake up and they can't fall back asleep. So, when my wife is a perfect example, for years, she hasn't slept through the night. And the doctor says, well, you're getting older. It's menopause. Look, all those things are true, that the hormones, they cause issues for sure. She started wearing blue light blocking glasses and she's sleeping through the night now. Why? And she's just building up her melatonin. So, there are things that we can do. And sometimes, an $80 pair of blue light blocking glasses can have such an important health benefit. We just need to be able to explain why that is.
Why?
And that's what I do. I'm a why guy.
And you've done it so eloquently today. I mean, I can't even believe it's almost 6 o'clock. Like we literally just scratched the surface. So clearly we're going to have to talk a little, delve more into this. And so we're having you back without a doubt to really delve, because we've talked essentially around, that inflammation that comes as a result of sleep apnea. So it's not just about you not breathing, it's what contributes to it and what does it result in, and how that impacts your metabolism. And really your mission, which is to look at both anatomy and function and metabolism, is really looking at this at a very global level. And I think that is just really what we need within the sleep space. So super excited to know you. I'm super honored and really excited about this new initiative that's coming up in April, where you're going to be able to get this out there to even more dentists and more individuals, more clinicians overall, and really hoping to build more collaboration, because I think the awareness of this, and that's the other thing I wanted to mention, this might also be part of why even sometimes when people are on CPAP, it is a life changer, don't get me wrong, for those who are able to tolerate it, they might still feel tired. And that might be because there may be some of that residual lingering issues with their metabolics that needs to be addressed. So so powerful.
Yes. So CPAP, inflates the airway, right? It's going to bypass the problem. But if the energy system in the body is still a problem, it's like when you, and I know we're running on time, and I would love to, get more into this. Should we talk about anatomy? How did I know that anatomy wasn't the total fix? if you look at the maxillomandibular advancement procedures where they break both jaws, they move it out, you've idealized anatomy. The cure rate is only 38%. So
Wow.
curing rate, meaning it completely eliminates sleep apnea. It'll make you better, but the question is, how much better?
Better.
And that's a tough procedure to go through without the guarantee.
For,
You know, if you get a
for
surgery,
30% improvement. Wow.
and that's why I said no to it. And that's why I had to say, look, I'm desaturating below 90% for over an hour. You cannot let that happen. That's going to kill me. So what am I going to say yes to? And I had a choice to make, and I made it. And you know what? I understand a lot of this is for some, it's going to be new information, and that's okay. What my message or what my goal is to bring it to more people, explain how I got there, explain how you all can fact check me and find out for yourself exactly what I'm talking about. Reach out to me. I'd be more than happy to share and point you in the right direction if that's something that you're interested in. And I'm excited to share it with you. You get it because you're right next door.
I know. So here's my big takeaway, and I hope you all watching this, either on the replay or currently watching this, is this. What is one thing that you can say yes to? Because when you say yes to that one thing, you will feel better. And tomorrow you can say yes to one more thing and one more thing. And you literally can build from there until before you know it, there's a snowball and you are just a whole different person. And so such a powerful, powerful, powerful lesson. Thank you so much. Now, where can people find you? Because I think people should just like go right ahead and start to follow you, because you are just a wealth of so much knowledge. Like literally, I'm telling you, we just grazed the surface here.
Yep.
So you guys need to go follow Dr. Cohen. But where can people find you? Tell us a little bit about that, and also where, what do you have coming down the pike?
Yeah, so I'm in Jenkintown, Pennsylvania, which is about the suburbs of Philly, about 30 minutes north, well, 25 minutes north of the city, right down the block from Abington Hospital. I'm born and raised here, grew up in Huntington Valley, and I didn't make it very far in life. I am 1 mile from my parents' home. You can catch me on Instagram at @AndrewCohen_DMD. And my office phone number is 215-572-7566. Sleep Healthy PA. That's where you can find me. I do no charge consultations, no charge 30-minute consultations to sit down, talk about what's going on with you and figure out if I'm the right fit for you. I want to work with people, whether you're a physician, whether you're a patient, whether you're concerned about a family member, someone who is looking to fight for their health and wellness. That's what I'm looking to partner with them.
Love it. Love everything you do. Thank you so much. Really appreciate you. So you guys heard, you could follow at healthysleeppa.com, and then on Instagram at @AndrewCohen_DMD, and we'll put all that in the notes and all of that. So this is what we're all about, right? We're all about moving that sleep health forward one step at a time. And this is really what I love about the power of collaboration. And so if you're out there and you're saying, I want more, I don't feel like I'm being heard, or I don't feel like there's someone who has really looked at this in a very detailed way, I absolutely would encourage you to take advantage of that 30-minute free consultation. I think that is my goodness, that's a steal. So, and if you're going to leave with at least a blueprint as to what is going on, I think that is a win, whether you now decide you want to move forward or not, but at least you know exactly what's going on. So super powerful. It is awesome to always just hang out with you guys. This is one of my favorite times of the week. And if you're out there and you're really trying to figure out what to do with sleep as well, where either you or your loved one is struggling with sleep issues, we at the Restful Sleep Place would love to partner with you. We have this mission in mind, which is to help families thrive by sleeping well so that they can reach their fullest potential. So feel free to check us out also at therestfulsleepplace.com. And until next time, I hope you rest well. And thank you so much again, Dr. Cohen.
It's my pleasure. Thank you for having me. I love it.